Hello everybody, my name is Megan Lambert. I'm a Bachelor of Nursing student at Indiana State University, and I'd like to take some time to talk to you all about my health education project, Behind the Smoke. Please take a moment and take this 10-question pretest. Throughout this video, we will be looking at who is considered to be in this population, what puts an individual at risk for becoming a member of this population, define and discuss addiction, briefly look at health conditions that the population is at risk for, what happens when quitting, we'll discuss ways to stop smoking, and I will describe what the baggie method is and how it helps stop smoking. This population can be simply defined as anyone who smokes cigarettes. Smokers are defined as any person who has smoked at least 100 cigarettes during their lifetime. Current everyday smokers, current someday smokers, all fall into this population. This includes social smokers, those who only smoke when they drink, smokers who have 1 cigarette a day, all the way to the smokers who have several packs of cigarettes a day. The Center of Disease Control, or CDC, found that individuals that fall into any of the following category are more at risk. Those categories include having a parent who smokes, a GED-only student, being an individual with low income, being uninsured, or having Medicaid, and those individuals with a diagnosed psychiatric disorder. The CDC research shows an individual with a GED only represents 36.8% of smokers, while an individual with a master's degree only represent 4.1%. Individuals in the low income bracket represent 21.4% of smokers, while upper income level represent only 7.6%. Individuals with Medicaid or who are uninsured are 2 times more likely to smoke than those with private insurance. Finally, statistics show individuals with a diagnosed psychiatric disorder are more than 2 times as likely to become part of this population. Addiction is defined as the compulsive need or use of a habit-forming substance. Cigarettes are addictive because of the nicotine which is in each individual cigarette. Nicotine affects 2 chemicals in the brain called dopamine and noradrenaline. As nicotine levels increase, the brain chemistry is affected, causing changes to the mood and concentration. The brain may become used to the chemical change, causing increased craving and ultimately addiction or the need for cigarettes. Smoking predisposes the individual to high risks of developing many health conditions. These health conditions include many conditions that affect lungs, like chronic obstructive pulmonary disease, or COPD, and lung cancer. Both of these diseases can affect how efficient the individual can breathe. Smoking also can affect other organs. Smokers are at high risk for developing heart disease. They are at a high risk for both stroke and heart attack, and countless other cancers and conditions. When a person decides to stop smoking, benefits can be noted in as little as 20 minutes. After 20 minutes of not smoking, the blood pressure and heart rate return to normal. In as little as 8 hours, the carbon monoxide level returns to normal, which increases the amount of oxygen in the body. And in just 24 hours, the risk of heart attack is greatly decreased. Over the next several days, changes continue. In 48 hours, damaged nerves start to regrow. In 72 hours, the individual can breathe easier and their lung capacity has increased. In 3 to 9 months, the individual continues to breathe deeper and starts having fewer colds. When the individual has stopped smoking for a year, there is a huge milestone. Heart disease risk has now decreased to half the risk from the previous year. At 5 years of no smoking, the stroke risk is now the same as a non-smoker. And at 15 years of not smoking, heart disease risk is as if you had never smoked. There are countless methods to stop smoking. The following are a couple tips to help you quit. Avoid triggers. Try a nicotine replacement therapy, such as the gum or the patches. When a craving hits, find something else to put in your mouth. Mints, gum, carrots, celery are all great examples of something else to put in your mouth besides a cigarette. Try to keep busy. Read a book, listen to music, play games. Drink plenty of water, and get rid of all temptations. Remove all cigarettes from your house or car. I would like to briefly describe the baggie method. This was information that was given to me at my clinical site for community health. It works by slowly decreasing the amount of nicotine that the body demands. Let's look at an example. So if George currently smokes 1 pack a day and has decided to stop smoking the 1st of August, he will get 3 bags. Each bag will have 20 cigarettes in them. On day 1, 2, and 3, he is allowed 1 bag of 20 cigarettes, and that is it. If any cigarettes are left over, they cannot be added to the next day. On day 4, 5, and 6, he will decrease by 1 and only have 19 cigarettes per day. He will continue to decrease by 1 cigarette per day every 3 days until no longer smoking. This method is not widely known, but is being taught locally with good results. The following slides are brochures that can be used to help with smoke cessation and to learn about the baggie method.